You can't replace part of the brain. Like, you
treat them the same.
A source of truth for the medtech industry.
Coexists with the province.
Robot understands things automatically.
Number one show in the medtech industry.
So Stryker got ahead of that and changed in the 90s, built $1 billion company that held up high, a lot of things.
State of MedTech with your host, Omar and Khateeb.
What's going on, everybody? Welcome back to the show. I'm excited about this episode because we're starting to do more health tech on the show. The problem with health tech is a lot of times I feel like when you look at health tech companies, they're not doing something that's really going to be transformative. They have like maybe cool technology or something, but nothing that really caught my eye. The company that I'm having on the show today and their co-founder really caught my eye because they're doing something that hasn't been done before, which is developing the world's first AI drug database and finding a way to give physicians the first intelligent AI prescription assistant. And that company is Posos. They essentially make intelligent prescribing easy and allow physicians and really any clinician to instantly dictate and refine prescriptions with AI that understands patient history, helps reduce risks, enhances the care, and empowers the clinician to focus on patient care versus clicking around the EMR and figuring out what prescriptions work with what and how do you max. Like, it's a huge pain. This is why physician burnout is on the rise, physician suicide, which we don't talk about enough, which is it's not necessarily the treatment of the patient or a practice of medicine that's burning them out. It's all these administrative tasks. And so Posos does just that. And so on the show today, I have Emmanuel Bilbault, who is the CEO and co-founder of Posos, along with his other co-founder, who's not on the show, but I just have to mention, which is Benjamin Goulier. So Posos is really the first dynamic therapeutic advice solution that was designed for healthcare professionals and then personalized to the patient based on the risks that are identified in their prescription and the latest medical data. One of the things they did earlier this year that caught my attention is that they became the first company in the world to create the first drug database that breaks down language barriers. So they essentially translated all the language of prescriptions and drugs, across the world and pretty much democratized it, right? And just for those investors who might be listening, the exciting thing about that, as we look at like ChatGPT and Google and all these generative AI companies, right? The real value is not necessarily in the AI, but the training data they have. And so with Posos, I think they're set up for a lot of success. I'm very excited about it. So this is our interview with Emmanuel Bilbault. Enjoy, and be sure to check them out at posos.co. Hey, everybody, welcome back to the show. Really excited about the founder and CEO who we have joining us today. That's Emmanuel Bilbault of Posos. Posos got on my radar because, as we know, I think if you talk to any physician, not a single physician says they dislike treating patients or practicing medicine. It's usually the administrative part of it. And as a result of that, we've seen a huge increase in physician burnout, even worse, physician suicide. And there's a lot of companies that claim to have some kind of solution to make this better. They really don't. Posos got on my radar because they focus on something that's really important, which is intelligent prescribing, right? So if you're a physician and you're clicking around an EMR, there's all kinds of things you have to click around to get to when it comes to figuring out the right prescription for the patient. And if you talk to anybody in internal medicine or primary care, the complexity is just getting worse. And so Posos has an AI database that essentially helps them do this. Emmanuel is going to be able to describe this much better than I am, but I was really excited about this. And more importantly, is that before I had Emmanuel on the show, I wanted to talk to some physicians, see what their reaction was to this. The 2 or 3 physicians I showed this to were really excited about it. So it just made me more excited to have him on the show. So Emmanuel, thank you so much for joining the show. How are you doing today?
Thank you, Omar. I'm fine. Thank you for welcoming to the show. Yeah.
Absolutely. Well, I'm excited to talk tech with you. But before we do that, can you tell us a little bit about your background? I understand that before you're a CEO and co-founder of this company, you were a pharmacist. So maybe give us a little background on yourself.
Even growing up, I was always like the doctor's son. My father is a doctor in a little village, and he was on call pretty much 24/7. So I think this deep commitment to healthcare is probably in my DNA from a childhood, And as you said, fast forward as a pharmacist, I was also on the front lines too, and seeing the complexity of prescribing. Checking the drug-to-drug interaction, drug-to-disease interaction, making sure that the patient get the best prescription they could have. And it's extremely complex. It takes a lot of time. And I think it's just unrealistic to think that within a normal consultation, physicians can spend 30 minutes to check if the prescription is fine. They definitely need an assistant, and that's what I'm dedicating my career now on.
Yeah, no, I think it's great too because it's really a huge pain. Even me, I remember in medical school how difficult it is, where you have to just click around and spend all this time formulating what the right prescription medications are, and doctors don't like that. At least most of them don't. So I think it's really interesting. Yeah, even pharmacists. Well, so I think it's interesting that you decided to sort of continue in the field of pharmacy, but then apply it as an entrepreneur. Can you tell us a little bit more, like how did this happen?
Maybe. Let me tell you how I see it. I think we all remember, maybe except the youngest of all of us, how we felt when we discovered the difference between paper map and GPS. I kind of remember the first time I used the GPS, and I remember how convenient it was to immediately get the right direction and the right journey to a place. And once you've adopted that, for sure you will use a GPS anytime you go to a new place. And then some years later, we discovered the feeling of driving in our own crowded city, with the traffic data, the live traffic data, like in Waze, for instance. And I think we just perceived the advantage of a data-driven approach of something. Because somehow with Waze, we cross-check the traffic data together with the road we need to use. But I think that the same plan we follow within Posos, and that's why I wanted to start a company, because it was not existing. Like bringing the same feeling to physicians, that they could have something that helps them drive their prescription the way Waze helped us drive on the road. And I wanted to build somehow the Waze for prescription, and that's called Posos.
Yeah, it's really fascinating. I think it's interesting analogy too, because for me, there's a way that I go to my parents' house, and I always use the GPS, not because I don't know how to get there, but because things might happen. And I was thinking about Posos because myself as a patient, I have like high cholesterol, and it took like a year or two for us to figure out like which is the best medication for me to take. And I kind of felt, I'm like, why couldn't we just have figured this out the first time I went to the doctor? And so so I'm pretty excited about that. Now, me as a marketing and branding guy, I'm always curious about the origin of things. So like Posos, I have no idea what that is. What is Posos?
Yeah, I guess it sounds Greek to you.
Yeah, it does. It sounds Greek to me.
But it's kind of a joke because as you can imagine, Posos is a Greek word meaning dosage. But dosage is called posology. We say Posos in French because I'm French. You can hear that. And so, we use Posos as a name, like to link it to the posology, as we say. And it reflects the company focused on optimizing medication, making sure you use the right drug at the right dosage for the right patients. And that's why I think it's the best we can do for patients, making sure he has the right treatment.
Fantastic. So let's talk tech. Tell me a little bit about the Posos software. Like, how exactly does it work, and what does that workflow look like for a physician?
Yeah, we want to build a powerful tool that is first embedded into the EMR or the EHR, and a tool that HCPs can rely on. And we wanted to solve the two major issues for physicians within. The first one is to be able to speed up the prescription process. So plugged into the EMR, Posos enables physicians to dictate a prescription with their voice, or just take a picture of a paper script to automatically get the prescription within their EMR prescription interface. So it's 5 minutes saved per patient. Yeah, it's huge. You don't have to type anymore on your keyboard or click a dozen of times to get a prescription done on your computer. So first, save time, 5 minutes per patient. At the end of the week, you imagine how much you can save. And secondly, as you said, Posos is an AI prescribing assistant. So it tells you how to correct or how to improve the prescription based on up-to-date knowledge about medication, of course, but also tailored to the patient profile. So we cross-check the patient data within the EHR together with the up-to-date knowledge about medications to make sure you make the right decision. So you simply prescribe faster with more certainty than ever.
Interesting. I think that's fascinating, but I want to ask you this question. I hope you don't mind me asking this, but EHRs have been around for a long time. A lot of times these EHR manufacturers, because they have all the data, they decide to sort of develop and release their own integrations and apps. So why hasn't anybody done this yet?
Yeah, I think the issue doesn't rely on the EHR. It's the job of the drug database that is behind the EHR. And until now, every drug database was made of text consolidated into a database. But creating a solution like Posos required the ability, as I say, to cross-check patient data together with medication knowledge. And with the current drug database, it's not possible because, and you can feel it, you get irrelevant alerts, box text that are not very useful. That doesn't help you prescribe. So if we want to build something that really helps physicians, we need to cross-check patients' data and medication knowledge, as I said. And for that, you need to have your drug database and your software speaking the same language, which is not the case. You have codings into your EMR. So it's like codings that describe patients' data. And you get text into the drug database. So you can't really let text and codings speak to each other. So we needed one language for everyone, the EHR and the drug database. And for humans, it's maybe English. Now we are having a chat in English. We also try to have the Esperanto. I don't know if you've heard about that, but I guess yes. It didn't really work. But for the medical softwares, by chance, this Esperanto language exists, and it's called the SNOMED. SNOMED is a terminology that gives the same codings for one pathology wherever you are, in Europe, in the US, in China, in Japan, exactly the same coding for diabetes, for example.
So it's one universal language for medicine, is SNOMED.
Exactly. So that's EMR and a drug database will speak the same language. So I think you guess what we've done. We've done and we built from scratch a brand new database where the content is populated only with medical knowledge that we have translated into SNOMED codings. So this database that we've built with Posos has all the knowledge about medication, all the knowledge about pathologies, and speaks the same language as the EHRs, so that for the very first time, you can perform queries within the drug database saying, I have these patients with those list of drugs he's taken, this list of pathologies he's suffering from. He has this renal function, for instance. Please give me the right treatment I need to use for asthma, for instance. And Posos will give the answer.
Interesting. And I believe you guys released some news about this. This is the AI drug database that I guess I saw news about, which is essentially these pathologies in other areas of medicine were not translated into this universal language of SNOMED. Posos went ahead and just took all of that and translated it. And so it's essentially, would you say this sounds like the most proprietary thing that you guys have? Essentially, you did this, correct?
Yeah. And it's a good question. So what we've done, as I said, is to translate the medical text in these SNOMED terminologies. But you can imagine for a human, even a smart pharmacist or a smart physician, it would take, 15 years to build a database like this. Maybe more with a team of 60 pharmacists. We had a team of 60 pharmacists to build that, so it's huge. But being able to select a text within a document, find out the right SNOMED codings, and put that on a database. It's very, very long. So we've used AI to somehow translate automatically the text that pharmacists have selected directly into the SNOMED terminology, which save probably 10 years, because we've done this first version, which is in French, in less than 2 years. And now the additional countries will take less than 6 months to be added one by one. And the
Interesting.
objective for us is to be the very first worldwide medication database, as you can imagine.
Wow. And I would imagine, and just for a lot of the audience that are new to this concept of AI, generative AI, is this essentially how you guys use generative AI? And for the audience, an example of that is ChatGPT, where essentially this accelerated your ability to translate these things into one universal database, correct?
Yeah. So I think we are the only one to be able to really use Gen AI for this this challenge, because even with a very good model of Gen AI, you need to have the model trained or fine-tuned, especially for a dedicated task like this. But the good thing is we've recorded every action that those 60 pharmacies have done. So selecting the right text, translating into the SNOMED codings with the AI, and then approve it or change it. We've recorded every action they've done. So it's millions of annotation we have recorded.
And this is over a period of 2 years, or how
yeah.
long? Okay, so 60 pharmacists. And of course they do thousands of them a day. So 60 pharmacists over 2 years. Okay.
Correct. So it's a huge data set that now we can use to fine-tune a dedicated Gen AI model to replicate this action and somehow automatically select the right text, automatically translate it into the codings. But we will always have the pharmacist at the end approving or not what the Gen AI have done, because we follow a quality control process to make sure that there is no mistakes, no error in the database.
Interesting.
But for sure, I said 6 months for an additional country. With the Gen AI, it's probably 10 times less.
Interesting. Yeah, I want to point something out here, because the generative AI and large language model like race has been very popular, right? With ChatGPT, Google has Gemini. And one of the conclusions, at least that I came to, is that what's going to be the most important thing is who actually has the best database for training those models, right? And so I just want to make sure I understand it for you guys, which is the database didn't exist because a lot of these pathologies, medications were not translated into SNOMED. You guys got 60 pharmacists and translated everything into there. So now you created that proprietary database with that training model, and then you're using your own data and training this generative AI model. So it's almost like you guys are 2 steps ahead. Essentially, I'm thinking about this from an investor standpoint, but it's almost like there's two barriers of proprietary knowledge that you guys have.
The task of translating one word like diabetes into a SNOMED terminology coding is relatively easy to do. So I guess general Gen AI models like maybe MedPalm, which is trained on medical content, will do it quite easily tomorrow. I'm confident about that. But converting a text which is probably 3-4 sentences into one word, one coding, is very different actions to do. And it's even sometimes the pharmacists are like 5 around the table trying to find the right codings to use, because in medicine it's never like black or white, it's always a little bit gray. And so it's an editorial process to define how to make a synthesis of a long text into one word or 2 words. And I think we are far from that. Like using general models to do that is very difficult for the moment. Maybe in 10 years or 5 years it will be done, but I'm not sure about it. That's why we need somehow to keep this expert data sets that we've built to perform this annotation prediction with a high level of certainty.
Interesting.
For sure, we've tried already with MedPalm or Gen AI models to do that, and it doesn't work without fine tuning.
Interesting. I'm wondering, so right now you guys are being used quite often in Europe, correct? And I believe you're making your way over to the US. What's been the feedback on clinical adoption? Because this is the issue I think that we see in health tech and med tech is new technology comes out. It solves a problem, but then it kind of creates its own problems, right? And so it complicates things for physicians. So what has been sort of the feedback with clinicians in terms of you integrating in their workflow and what have you guys learned?
So first of all, we've fully integrated their workflow because Posos is not a dedicated software that you have to use in parallel to your EMR. It's embedded directly into your EMR. And moreover, it's embedded into the process because we don't change the user journey within the EHRs. So first of all, we started with the AI prescribing assistant that somehow physicians loved, but you know how it is. They are all overwhelmed with these administrative tasks, many patients to see. They have no times. And sometimes even like asking an assistant to get a reco, it's 10 seconds, but 10 seconds is too much. So quickly we identified the need for like saving 5 minutes to let them do a 10 seconds check. It's somehow the ratio. And in the prescribing process, what is very long is in hospital, for instance, find a computer that is available, type the prescription, click a dozen of times to get the prescription ordered, and it takes 5 minutes and sometimes more for elderly patient with a lot of drugs because you have to type the drug name, the dosage, what galenic forms you want to use, what exactly is the dosage for each drug. So it's a very long process. So we believed if we can fully automate this process, it's 5 minutes saved. Let's do it in two ways. It's a new prescription. You just dictate the prescription, it's done. And there is an existing prescription, like paper scripts. Let's just use our own mobile phone. So you can have your iPhone. You take a picture of your paper scripts, and automatically, just like magic, it's inside your EHR prescription interface. So with this argument of saving 5 minutes by patient, not having to type any prescription, somehow people loved it, and we don't see any physicians that saying it's too complex for them, they don't want to do that, they are overwhelmed. So the real issue now is to have the somehow informatic teams of the hospitals dedicating sometimes to plug Posos to the EMR. So it's no big deal, but that's the challenge we are facing. But yeah, in the last 3 months, we had 30 hospitals who did that, for instance. So yeah, it's going quite well in Europe. I'm happy with that.
So let's if we can role play for a moment. Like, let's say I have a patient comes in and older patient, they have a lot of comorbidities. They were doing chronic disease management stuff. What happens if I don't agree completely with the AI recommendations? How am I, as a physician, are they able to personalize that and change that, or what's that workflow look like?
Oh yeah. So Posos is not telling you which drug you need to prescribe. It's shortlisting you the drugs that are compatible with your patient profile and the disease you need to treat. So you always select 1 out of 5 or 10 drugs that are suggested. So you keep the decision. Physicians decide. They don't.
So Posos is just narrowing down the options. So you're supposed to, so okay, which I would imagine that also helps in terms of getting through the FDA as well. Because if you are actually making the direct recommendation, that makes things a lot more complicated. Yeah. Okay, so that's interesting now. What, at least with so you guys integrate into all EHRs. I guess in Europe, you're doing the same thing in the US. So Epic, Cerner, et cetera. What were some of the difficulties you found when it comes to like integrating with the EHRs? Because at least from when I used to work in software and EHR integration, like that was a very complicated thing. Was that difficult for you guys as well?
Yeah, I think in the US, you're ahead of Europe for the EHRs because pulling data from the EHRs, like taking the patient profile, the list of drugs they are having, their comorbidities, some biological test results are quite okay now because connectors are existing, so you need to partner with the EMR, but it's something relatively easy to get. There is still a challenge in pushing data from Posos to the EMR, importing data within the EMR, and that's what we've done in Europe. So we have about 20 different EHR publishers in Europe. And within 1 year, 15 of them have integrated Posos in this importing data flow process. And they all came back to us saying, that's quite easy. We are using the FHIR norm, so it's like the more modern one. And it takes for them less than 3 weeks to do the connections. And one is connected for in the EHR, it's available within all the hospital equipped. There is a little bit of configurations to do, but it's some days only. So it's all right. It's always the beginning, like the very first steps, having 3, 4, 5 hospitals willing to move forward with Posos, and once they are like willing to move forward with us and the EMR, things are going quite well. So, I can use this this podcast somehow to say like if there are some hospitals interested in testing Posos, I'm quite happy to chat with them.
Fantastic. Just on that same note, so with Posos, you know, the value proposition that you guys are providing to the hospitals and clinicians is, one is improving efficiencies, like hospital efficiency, and the other side, of course, is like the goal is like patient outcomes. Do you have any examples of how maybe you've provided better hospital efficiency, patient outcome? What I'm trying to see is like, especially as like for investors and clinicians, they want to know, like, with your early adopters, what have they experienced so far?
Yeah, we had a first studies we've performed in one university hospitals, and we measured at patient admission the percentage of prescription with mistakes, and we measured it as well when patients were leaving the hospital coming back home. How was the prescription? So at the admission, we had between 40 and 60% of prescription with at least one mistakes, which means like some drugs that are not compatible, some dosages are not relevant for patient profile. Without Posos, 80% of this risk were remaining where patients were leaving the hospital. And I think the same figures are everywhere in the world the same. Yeah. With Posos, only 20% of patients leaving still have a risk in the prescription for some reasons, which means that we divided by 5 the number of prescription and patients with risk in their scripts before and after Posos. So it's a huge difference, because imagine 5 minutes saved for each of these patients at the admission to take the prescription and comorbidities, and 5 times less risk of patients coming back to the hospitals or having like issues, side effects at home. It's a huge difference, and somehow the impact is much higher than any drugs, any how we call that, these drugs that are transforming the system. We say blockbusters, you know. So I guess the impact is higher than any blockbusters in terms of medical and economic impact for the health authorities. Yeah.
That's fantastic. As we kind of round out the interview, and thanks, I appreciate you coming on the show. There are some physicians who, as I was talking about Posos, I got some questions from them, but also I wanted to get your thoughts because I feel like in the last few years, like let's say the last 2 or 3 years, generative AIs and these LLM models have been very, very big. When you look at the future of AI in healthcare, like how do you foresee it changing the healthcare landscape, and then more specifically, how's that going to change Posos?
Gen AI is great when it can perform a task that is time consuming, but a task for which the results can be checked very quickly by human. So like generating a text, generating a pictures, it's easy to say it's crap or it's great. Generating a prescription, it takes 30 minutes to check if it's good or not, because that's what we said at the beginning. So I'm not sure Gen AI would be the best tool for prescribing. It would be the best tool to make a summary of patients and doctors' discussion. It would be great to generate documents or leaflets for patients. It would be great to suggest options for an additional drug, but to check a whole prescription for a patient profile, I'm not sure that's the best technology. There may have other type of models coming in the near futures that we still don't have. That could be, I guess, more relevant for prescription. Because it's hard to check if it's right or not, once again. So for sure, AI will be everywhere. For sure, LLMs or Gen AI will be everywhere, but I'm not sure for the prescription for the moment.
Got it. That makes sense. So as we round out, just a couple of questions from some physicians. So one is Dr. Cheng Ruan, who's very well known in the AI space. He's a integrative medicine physician. So his question was like, what is the dream in having professionals use a technology like Posos? As in, like, what's the biggest problem that they're trying to solve? So we talked about a variety of problems, but like, what would be the biggest one?
Yeah. There is one word that comes to you from physician feedbacks when they use Posos. It's mental load. They all say that their mental load decreased a lot when they use Posos, because it's just like having a high skills professor saying, Omar, you did the right choice. You can come home without any doubt. You made the right choice. Because they say when they come home after a long day, they always think about the treatment they prescribed, the patient they saw, the diagnostics they've made. And as we said, it's always a question of probability. So you are not 100% sure you made the right decision. But if there is an AI assistant you trust, you rely on, that tells you you've done the right decision, you feel much better. So I think the dream for a physician is to enjoy treating patients without having this heavy mental load you bring with you at home.
Yeah, that makes sense. Another physician, and I think this is also more relevant, Dr. Kasim, who's a nephrologist. So a nephrologist, I mean, aside from like some of the procedures they have to do for patients like dialysis, those are really complex patients, because anybody who is seeing a nephrologist, usually they have a lot of chronic conditions that come along with it. What were the exact inputs that Posos is using from the EMR to help make decisions, like whether it's weight, EGFR, etc.?
Yeah, for this specific example, it's a good example. For nephrology, there is a question of using the right medication based on your kidney function, and especially for that, you need to cross-check data, patient renal functions together with the medication information. And here's the way physicians work today. They have to open, for every drug you take, the leaflets, checking if the drug is contraindicated or not for renal failures. And if it's not, checking if you have to adapt dosage based on your renal functions. And if yes, adapt the dosage for drugs like one by one. You can't have any overview of your prescription saying, out of the 10 drugs you take, 3 have to be switched to another drug, 5 have to be adapted for the dosage. And these are the dosage you need. Without Posos, you have to do it one by one. It takes 30 minutes probably. with Posos, you have immediately the overview of the drugs you need to switch. And as I told you, Posos will shortlist the drugs you can use instead. And for those that need a dosage adaptation, Posos will just suggest the right dosage for your patient profile. And this is a great example in nephrology where having an AI prescribing assistant make a huge difference in your daily practice.
Perfect. And that perfect segue into the last thing I wanted to ask, which is Dr. Dan Roshan is a good friend of mine. Shout out to you, Dr. Roshan. He's actually going to be, he and I, we do jiu-jitsu together, but we were talking about it the other day, and his thing was, what are the barriers for this to leave the hospital and be implemented, let's say, in primary care practice?
I think that the same barriers than in a hospital is having the EMR publisher embedding Posos into their software. But it's a win-win model somehow, because the way we work is we have the EMR publisher distributing Posos to their customers, and our business model, sorry, we talk about business model, but it's important, is a revenue share model. So if they have Posos as an option for their customers and customers subscribe to Posos, somehow they make money with that. Physicians save time, make better prescription. And it's a great way for Posos also to enter the private practice area. So it's really a win-win-win models. And it's just about convincing the EMR to move forward. We did that in Europe, and we'll do that together, a physician in the US for sure.
Perfect. Well, Emmanuel, I really appreciate you coming on the show. Last thing I wanted to ask you about is, right now, so Posos is a startup and everything. Can you talk just a little bit about where you guys are in terms of your fundraising? I believe you're doing a raise this year, and what conferences that you guys might be going to that investors might be able to look you guys up and meet with you.
Yeah, we will be in the following days at the HIMSS conference, and that's a great place to meet for sure. And we'll probably be as well at the health conference. I think it's in the West Coast this year. I think maybe in I'm not sure where is it. Las Vegas, I think. But we'll be there for sure in November or October. But also, we are living in a world where there is a video conference, and we are doing that, Omar, today. So they can contact me at Posos. hello@posos.fr.
Fantastic. And also, I've been noticing you've been putting out more content on LinkedIn, so I'll let the listeners know to be sure to follow you there. Emmanuel, thank you so much for coming on the show. We're going to be excited to follow you along this year. I'm your host, Omar M. Khateeb. If you guys aren't following already, go check out Posos online, and we'll see you all next time.
Thank you for enjoying another epic episode of the State of MedTech. If you're feeling inspired and love this episode, do us a favor, hit that subscribe button and turn notifications on so you never miss an episode. And be sure to give us 5 stars and write a short review, because that helps more people discover this amazing community of ours. If you're a company who has a executive that you'd like to be on the show, or perhaps you want to sponsor one of the episodes, shoot us an email at hello@khateebandco.com. Take care, and we'll see you next time.